लेकिन एक एडिक्ट को बार बार कहते हैं कि तू तो जानबूझ के ये सब नाटक कर रहा है. So again, the relapse rate is high, which is very similar to any other chronic disease. But unfortunately, nobody talks about that. They all only say that you are unnecessarily doing this repeatedly. That is the cause you are here. For example, एक जने को जो biggest invention of last century है वो है antibiotics. But unfortunately, penicillin जो first antibiotic थी World War में बनी थी, उसको आजकल यूज बहुत मिनिमल हो गया है और वो इसीलिए कि कुछ लोगों को एलर्जी होती है और उस एलर्जी से उनकी डेथ हो जाती है. So we decided not to use it because there are more advanced versions or different medicines जिनसे एलर्जी के चांसेस कम है. Now similarly, substance से कुछ लोगों को इशू है और उन लोगों का ब्रेन अफेक्टेड होता है. That does not mean कि हर जने का ब्रेन अफेक्टेड. Over the time, they have find out there are 3 reasons. One can be genetic reason that we in genes there is some deformity or our gene is different. Unfortunately, we are not able to pinpointedly find out the which gene is there. So ऐसा माना जा रहा है कि मल्टी जीन्स में प्रॉब्लम है. बहुत सारी स्टडीज से पता चला कि जिन फैमिली में इश्यूज थे उनमें इट वाज more as compared to general population. Like if someone has a issue, then his child has a more chances of getting addicted, which is proven over the time again and again. This risk is 7 to 49 times more. If both the parents are affected, then the risk is up to 50% more than the normal population. सेकेंड वॉज कि हमारे ब्रेन में कुछ स्ट्रक्चरली डिफरेंट है. मे बी वी कैन नॉट हैंडल द सब्सटेंस. दैट इज द सेकेंड. एंड थर्ड इज दैट मे बी हम लोगों को कोई ट्रॉमा इन्फेक्शन कुछ ऐसा हुआ जिसकी वजह से हम लोग इस सिचुएशन में पहुंचे. बॉटम लाइन ये है कि आज की तारीख में वी आर नॉट एबल टू मैनेज आवर सब्सटेंस एंड इफ वी कंज्यूम देयर आर चांसेस वी विल गो हेवायर. ओके. Now this article was written and Dr. Nora Volkow करके एक नीडा की डायरेक्टर हैं. She is like goddess for us. She is the one who is saying that addiction is not a moral failure. There is definite defect in the brain and that's why we are here. Now, over the time, maybe we will have the tests like the MRI and PET scan for the addicts to evaluate whether their brain is healed or not. Now, based on her research, in 2007, this article was published with the thought that another 5-6 years, we will have a definitive answers of these research. Unfortunately, US economy was very badly affected because of multiple wars and they are the one who invest the maximum amount into the medical research. So there is not much has been done in last almost 15 years. But whatever is there, it is worthwhile to understand that very, very clearly. So I am going to explain you what is the kind of a thing they have understood in this article. So I am summarizing. Please be careful and listen. Each and every word is very, very important. So they have started the article that there are a lot of new research being done which are suggesting that addiction is clearly a disease. This is because of the new technology and the research modules. Lot of new machines are there which are indicative of this. It is said to be not moral failure, like someone is not morally weak to be here, but still the society treated like a moral failure. That is a very interesting phenomenon. Like when I was young, the feeling for diabetes was almost similar. There was a movie and they have said the diabetes is there in the ones who are rich. So it is not a common man disease. It is when you are obese, you have more, then only you have diabetes. Now over the time, it's clearly proven that diabetes has no role with the affluent. It can happen to poor, rich or anybody. Now similarly, at the moment, addiction is treated like a moral failure and it happens only to somebody who is character-wise weak. But over the time, it's proven that there is no role of moral failure. Rather clearly, there are three areas which are the main cause is genetic, biology and trauma. Now over the time it is clearly proven that these are the only three reasons the science could able to find out till now. Now that means if it's a disease, then it should be treated like one. Means you should compare it with the heart problem, with the cancer or with any other medical disease. Like for cancer, nobody will say I can manage my cancer on my own. कोई भी कैंसर का जो इलाज करा रहा होगा वो डॉक्टर के पास जाके ये नहीं कहेगा कि मैं अपना इलाज खुद कर सकता हूँ. वो हमेशा डॉक्टर को यही कहेगा कि मुझे आप सजेस्ट करो क्या करना है. बट यहाँ पे unfortunately everyone thinks that he can manage himself, and this is because still our understanding or our knowledge about the substance is very poor and the education is very bad. Simultaneously, the relapse rate or the chances of somebody going back into the substance is substantially high, 60 to 70%. But over the time, scientists clearly proved that there are many chronic diseases which has similar relapse rate. Like, अगर किसी को अस्थमा है, या ब्लड प्रेशर की प्रॉब्लम है, या हार्ट डिजीज है, तो ऐसा थोड़ी है कि एक बार उसने ठीक करा लिया, वो डॉक्टर के पास गया तो दोबारा से कभी रिलैप्स नहीं होगा. तो उसको तो कोई जना कुछ नहीं कहता है, लेकिन एक एडिक्ट को बार बार कहते हैं कि तू तो जानबूझ के ये सब नाटक कर रहा है. So again, the relapse rate is high, which is very similar to any other chronic disease. But unfortunately, nobody talks about that. They all only say that you are unnecessarily doing this repeatedly and that is the cause you are here. Now, when they started talking about the option for treatment, see, interesting thing. Now, it's a disease, but when we talk about option for treatment, normally the treatment is thought to be medicine, some surgery, some major change. But there is no such thing for addiction. Rather, whenever we talk about the treatment and options for treatment, the option is be in a rehab with the hope you will be healed. Attend A or NA or self-help group with the expectation that you will be able to help yourself. See the misery. And this is the unfortunate thing, that why we are not able to develop the trust, because we are not able to do specifically any treatment. But definitely there is lot of information which we can use for our treatment, which is like a add-on. And this article talk about those add-ons very precisely. And अगर आप इन चीजों को अच्छे से समझ गए, then you will be able to help yourself in a better way. Now, when they talk that the relapse rate is much higher than the cancer. Now that means any one of you taking this treatment lightly will lead to a difficult situation and he will be back here again, or into the same crisis kind of a situation again. Now, it is worst being because of the social situation. Because socially nobody recognizes this as a disease, so it is worse situation. Worse because of the social situation. Now, there is a memory making pathway. Now, like, if you have to remember anything, there is a process. Now, unfortunately, substance hijack this. Means, if you are under the influence of substance, you won't remember what you are doing. You will remember only partly, or this is manipulated by your substance. What will you remember? Like, you are sleeping on the road, but you are saying, oh, we had a great time. You are doing miserable things, but you will say, you had a ball of the time. Now, maybe you abused, you peed in your pants, which is very sad or bad for you, but you will only remember that maybe, I am not sure. So if someone tries to explain you have done this, you will only say, I am not sure. I don't think so. And for this, it would be worthwhile if you call your family and ask, what all I did, so you decided to send me to place like Tulasi, and you will get a lot of information which will give you direction. Now, it exploits the emotion. What does that mean? That means that there are times you will get emotional, that why they are talking like this. Or a typical thing is that drinking is much better than otherwise, because at least I feel happy. No one cares for me. Like typically, a girl came to me after attempting suicide, and she says, in life, if something is real to me, is my Gorav syrup. Because my husband and everybody just want something out of me. This is the only thing which gives me happiness without any. तो हम लोगों को क्या लगता है कि हमारा नशा ही हमारा असली है, और ये चीज को बहुत अच्छे से हमारा नशा एक्सप्लॉइट करता है, जिससे हम बार बार करने लगते हैं. उसके बाद में उन्होंने बात करी है पाथवे ऑफ सेलियंस। Now this is a spatial pathway or survival pathway. Like if you are stuck in a place for months or weeks and you come out, you will not think what kind of a food, you will not think purified water, you will just drink anything. Because for survival, that's what you needed. If you are dying, you will do anything to survive. ठीक है? But otherwise, हमारे बड़े thoughts हैं, हम बड़े careful हैं. Now substance take the pathway of salience and you won't realize, you start behaving as if you don't get substance, you won't be able to survive. So literally, alcohol or any drug takes over your brain and जब हमें नहीं मिलती है तो हमें ऐसा लगने लगता है कि हमारे सर्वाइवल के लिए तो ये जरूरी है। क्यों? बिकॉज हमारे जो बेसिक सर्वाइवल पाथवे है उस पे जाके बैठ जाती है और आपको अच्छा बुरा कुछ नहीं दिखता है उस टाइम में। क्या होगा ये तो फ्यूचर की बात है, अभी तो मेरे को चाहिए तो चाहिए। And that's why when we come here, we are so desperate to get out because we are having those cravings. Now, addiction does not only discuss about the or involve about the chemicals. There can be lot of habits like gambling, shopping, pornography, these days social media, internet, maybe phone. These are the kind of a addiction and food. So, lot of time we come out of chemical addiction. हम लोग नशा तो बंद करते हैं मगर इस तरह के नशों में इन्वॉल्व हो जाते हैं and that affect our life similarly and equally. Now इसके बाद में उसने ब्रेन में कहाँ-कहाँ changes आ जाते हैं. So he defined 3 areas which are affected and which are very very crucial. One is the prefrontal cortex, which differentiates us from animals. The second is the pleasure pathway, and third is the stress. Now, prefrontal cortex is the most significant, and healing of prefrontal cortex is going to make a difference in your success or failure of the treatment. Of course, if you do substance, you will feel happy, and that is never going to change. Whenever you will do substance, you will get feeling of happiness. So ये तो बदलने वाला है ही नहीं. क्या बदलेगा? बदलेगा तो आपकी लॉजिकल थिंकिंग का लॉजिक बदलेगा कि आपको नशा अपने लिए क्यों नहीं करना है. Now it cannot be a forced decision. It is a very thoughtful kind of a decision, but you are stuck here because unfortunately healing of prefrontal cortex is a very time consuming process and it takes 3 months to 24 months. हमारे ब्रेन की हीलिंग में लॉजिकल थिंकिंग आने में कितना समय लगेगा? 3 महीने से 24 महीने. और इस टाइम में there is a clear risk that if you get exposed to substance, you will not be able to control it. Now, of course, नशा लेने से खुशी तो मिलेगी and heightened खुशी मिलेगी, तभी तो आप नशा करते हो. और अगर स्ट्रेस होगा तो आपको इच्छा तो होएगी कि नशा करके आप अपने स्ट्रेस को कम करें, बट दिस इज द हॉट टॉपिक जहां के लिए हम लोग बहुत सारी मेडिकल रिसर्च कर रहे हैं, and we are trying to find out that maybe in future we will have some medicine by which I can control and you will not get high because of the use of the substance. And if that happens, maybe I will dissociate your feeling of happiness with the substance and gradually your craving will go away. But अभी मेरे पास कोई 100% प्रूवन मेडिसिन नहीं है। हमारा ब्रेन पूरी तरह से वाट लगी है। इमेजिन हम लोग जानवरों की तरह से बिहेव कर रहे हैं बिकॉज हमारा प्री फ्रंटल कॉर्टेक्स काम नहीं कर रहा है। तो क्या करते हैं हम? नशे के लिए कुछ भी करने को तैयार है। क्यों? बिकॉज हमें ये लग रहा है कि अगर हमने नशा नहीं किया तो हम सरवाइव नहीं कर पाएंगे। सो जब हमारी हालत खराब होती है और लॉजिकल थिंकिंग थोड़ी पावरफुल होती है तो हम नशे से दूर रहते हैं, लेकिन जैसे ही वो कम होने लगता है डिस्ट्रेस, तो हमारा प्लेजर पाथवे दोबारा से कहता है भाई कर ले, क्या हो गया, थोड़ा कर लेगा तो क्या हो जाएगा, एंड वी विल कीप रिपीटिंग द सिमिलर मिस्टेक्स अगेन एंड अगेन। हम उस साइकिल में उलझ जाते हैं और बार बार वही गलतियां करते हैं जो आइडियली वी शुड नॉट डू। Now after this basic information, they have given the uses of it. Now first use was that maybe in future we will have MRI or PETs which will give us the direction of healing. Now that means today what I am asking you to spend days, in future it will be based on the PET or MRI result. So मुझे आप कहोगे भाई मेरे को जाना है, मैं कहूंगा मैं तेरा पैट करा के देखता हूं तेरा ब्रेन हील हुआ है नहीं हुआ। अगर नहीं हुआ तो तेरी मर्जी है, जा फिर आएगा, या तू लग के इलाज करा ले और हील हो जा। Unfortunately, most of the research being done in US, there healthcare is very expensive. The kind of a treatment you are getting will easily cost somebody $1,000 a day. Okay. Now that means the insurance company does not want that you should have a long treatment, because then they have to take out lot of money for this. Now considering they have said that we will only sponsor 21 to 28 days, 3 weeks to 4 week treatment, and they have lot of justification for their behavior or their this decision. Now over the time scientists clearly find out that minimum treatment duration is required is 90 days. Now see the conflict. Insurance company, which is very strong lobby, wants the treatment should be only for 3 to 4 weeks, while the organization or doctors feel that this will not be effective and this will be effective only if it is done for the 90 days or again. Now, clearly proven that treatment will require 90 days to 2 years, and for example, when Sanjay Dutt got successful, he was in a rehab for almost 2 years. Lot of patients who are not able to control themselves, they require treatment up to 2 years time to be successful. So repeated treatment failure does not mean it cannot be successful. It only means you require maybe a prolonged duration of prolonged treatment for being successful. अगर आप ऐसा नहीं करोगे तो आपको सक्सेस नहीं मिलेगी. Any exposure, sight, sound, smell, thought can cause immense craving. Like, I had a patient. She was in Delhi for 3 months. As soon as she reaches to her house in Bombay, she goes to her bathroom. And she was on cocaine before coming here. She used to score cocaine on her bathroom board. Now suddenly after entering the bathroom, there is such an immense craving that after 15 minutes, she was again doing the cocaine. You go back to your house in the same surrounding. Let's say you sit on your bed and watching TV. Suddenly, you will see by reflex your hands are moving as if you are drinking. There are times you meet your friend and you have an immense craving. You go to the bar or surroundings, you get tempted to drink again. So, any exposure can be cause of immense craving or relapse. If you are a human being, you should get yourself treated and not experiment. We keep experimenting and failing. क्या करते हैं हम? एक्सपेरिमेंट करते हैं एंड रिपीटेडली फेल होते रहते हैं. इट्स बेटर वी शुड स्पेंड extra time for healing. As time passes, your craving reduces. जैसे जैसे टाइम निकलता जाएगा आपकी तलब कम होती जाएगी. बट लॉजिकली आपको अपनी बीमारी के बारे में अच्छे से समझना पड़ेगा और तभी आपके चांसेस हैं कि आपका ट्रीटमेंट सक्सेसफुल होगा. अदरवाइज यू विल नॉट बी सक्सेसफुल. इट्स ए प्योरली ए साइन like any other disease treatment, and you have to accept your disease, and then only there are chances of you be on right path. It's not approximation. It's not that you can manage yourself. You require long-term help, and then only there are chances you will remain all right. अगर आपने मदद नहीं ली, जो बिगेस्ट मैंने केस देखा है, जो लोग लंबे समय के बाद भी रिलैप्स हो रहे हैं, जो कि हेल्प नहीं ले रहे. If you take help, then you will not relapse. It's like any other treatment. अगर आपको हार्ट प्रॉब्लम है, कैंसर है, कुछ भी और प्रॉब्लम है, you require a sincere treatment to remain all right. Let's say किसी आदमी को कैंसर हुआ, डॉक्टर ने कहा आपको ये हर 6 महीने में टेस्ट कराना है. उसने टेस्ट कराया, उसमें दोबारा से कैंसर आ गया, तो क्या वो डॉक्टर को जाके ये कहता है तुम्हारी वजह से मैं कैंसर में फंस गया? Now similarly, अगर आप रिलैप्स हो गए, that only means आपको एक नए सिरे से अपना इलाज कराने की जरूरत है, बेमुकाबले और लोगों को ब्लेम करना. So it's a high time you should accept your problem as a disease and look for a right kind of a solution than going and repeating the same solution. So this is what is written in this article, and now we are going to read